my name is Megan. I'm your student nurse today, and today we are just going to be doing a respiratory assessment. Okay, so first I'm just going to wash my hands, and then I would clean my stethoscope also. So first I just have a few questions for you, and then we'll get into the whole assessment, okay?
Okay.
Do you have any present symptoms?
No.
Any shortness of breath, cough, congestion?
No.
No. Okay. Any history of any respiratory problems?
No.
Like COPD, asthma, pneumonia, nothing like that? Do you have any family history of that?
No.
Nope. Okay. And what's your occupation?
Construction labor.
So no farm or factory work?
No.
No. Okay. Do you smoke?
No.
Which includes vaping, e-cigarettes? No.
No.
Okay. Any medications you take for respiratory issues? Like opioids, oxygen, inhalers, nasal sprays? No. Okay. So first I'm also, as I'm asking him these questions, I'm looking at his skin color to make sure he's not blue or gray. His lips don't seem blue. He has no pursed lip breathing. He feels warm. He doesn't feel cold. And then I'm also looking at his thorax. So I'm watching him breathe, make sure it's symmetrical. No barrel chest, no retractions or use of accessory muscles. I'm also checking his fingers for any clubbing. And they look good, no clubbing there. So then, after I look at his thorax and he's all good there, I'm going to have him turn around. And I'm going to palpate. So I'm going to look for tactile from excursion. So I'm going to go down to his 10th rib and I'm going to have you take a nice deep breath in and out. And here I'm just watching, again, for my thumbs to expand up and evenly, 1 to 2 centimeters, which is good. And I'm also going to have you say 999 all the way till my hand gets down here, okay?
999.
Again?
999.
Again?
999.
And again.
999.
Good. And then here is where I'm listening for the tactile firmitis, which increased vibrations could mean like pneumonia fluid, and decreased could mean like asthma or like a pneumothorax. And I do not see any of that there. So while I have him sitting like this, I am going to percuss. So I'm just going to percuss over each lobe where I would listen. While I'm percussing, I am listening for renaissance, which is a normal sound. Hyperrenaissance could mean like asthma or COPD. And then dull, which would be like a thud. And then I'm also listening for flat, which could be like a tumor. So I'm just going to percuss. And then I'm going to have you lift your right arm right away, and I'm going to percuss here. Good. And then you can turn around and we'll percuss on the front. Good. Okay. So now that we did that, everything sounds good. I'm going to also listen to his breath sounds. So while I'm listening for bronchial breath sounds, which is like a Darth Vader. It's howl and like a blowing sound. I am listening for bronchovesicular, which is equal for inhale and exhale, which is like a medium pitch sound. And then I'm listening for vesicular, which is a low pitch sound. Long exhale, short inhale. So I'm also when I'm listening to his lung sounds, I'm listening for crackles, which are normally in the bases of the lungs, which sounds like leaves, like there's fluid in there, which could mean that there's fluid. I'm listening for rhonchi, which is like more of a snoring sound, which could be like COPD or heart failure. I'm also listening for a pleural rub, which is when there's not enough lube and the lung tissues are rubbing together. I'm listening to make sure that I can hear his lung sounds and they're not absent or diminished. Diminished would just be quieter, harder to hear. And I'm listening for any wheezes. It's a high-pitched, more musical sound, which can mean like asthma, narrowing of the airways. So here, I'm going to have you inhale through your nose and exhale through your mouth, okay? Nice deep breath. Good. Okay, I'm going to raise your right arm, and I'm going to listen on the middle lobes too. Again. And again. Okay, and then I'm going to have you turn around. And I'm going to listen on the back side now. Nice deep breath. And one more. Good. So that is our respiratory assessment.